Suppression of COVID-19 does not have to equate to lockdown. Suppression can actually be done with robust testing, tracing and isolating policies, strict border checks and minimal restrictions. This is how Taiwan and South Korea have saved their economies, and these countries never had to use national lockdown measures. There is an unhelpful public discourse of pro versus anti-lockdown, but this is a false distinction. Who is actually pro-lockdown? This is about finding a sustainable solution until there is a vaccine, better treatments, mass testing, and more information on reinfection, immunity and long COVID, post-COVID complications in previously healthy, young people. I fear that those advocating lifting all restrictions have not looked internationally at what this would mean. It would result in poor economic recovery, because behaviour will change to avoid being infected, as well as a strain on healthcare services. The case fatality rate of COVID-19 is low, because of top medical treatment. If there are not enough beds or oxygen for all who need care, this fatality rate will jump higher. This means health services coming under strain again for all patients with all needs, and doctors making difficult triage decisions on who to offer care to. Studies show rich countries are at around 10% exposure, which is far off the 60–70% population level exposure that some think would lead to less spread of the virus. At this point, if immunity does not last, with cases of reinfection already seen, we are more likely to see epidemic cycles of COVID-19 rather than a static state. Even for measles, which offers lifelong protection after disease, herd immunity was never reached, and the virus continued to kill large numbers of children and vulnerable people. I understand the anger, frustration, and grief of the public after 6 months of restrictions, but the problem is the muddled government response and the virus. SARS-CoV-2 is not going away until governments actively make a strategy to deal with this situation, taking a multi-year view, and take on the lessons of East Asia, that the fastest economic recovery will come from a functional test/trace/isolate system, strict border checks, actually enforced, and trust in government's response. Unfortunately, the UK does not have any of those three right now, which puts us into this state of having both a substantial public health and economic problem, and increasing social unrest.